Are you looking to optimize your health? Are you looking to get the best supplements at the lowest price? For high quality supplements and to talk to someone about what supplements are best for you, go to takeyoursupplements.com and one of our fantastic True Health coaches will help you pick out the right supplements for you that are the highest quality and the best price. That's takeyoursupplements.com. takeyoursupplements.com. That's takeyoursupplements.com. Be sure to ask about free shipping and our awesome referral program. Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 132. Oh my gosh, I am just so thrilled for today's interview. You have no idea. Anytime I get to interview a naturopathic physician, I'm like a kid in a candy store. I'm like, I just have my pom-poms out. I love naturopaths so much, and especially naturopaths who've been practicing for decades, because they have so much experience under their belt. They really have been around enough to see what really works. Naturopaths are truly the doctors that we should be looking up to when it comes to actually healing, especially healing chronic disease. Stop looking to MDs and drugs for healing something that the body needs to be supported in healing. Drugs don't support the body in coming back into balance. And if you've been a long-time listener, you've heard this over and over again. Dr. Lance Morris is absolutely one that I look up to, and I'm so excited to have on the show today. In fact, a few episodes ago, I interviewed the author of Poisoned, Alan Bell. And if you'd listen to episode 124, if you haven't, go back and listen to it for sure. At one point, he shares that he was stuck in basically a medical bubble for many years in the Arizona desert. And I said to him, well, naturopathic medicine might have helped. And he said, if I hadn't had naturopathic medicine, I would be dead. And I said to him, I have to interview your doctor. Of course, that's Dr. Lance Morris. Thank you so much for coming on the show.
So thanks a lot, Ashley. That was a delightful introduction. And Alan set the stage for both of us.
Yes, he did. Well, and I was just so thrilled. I mean, looking at your credentials, you became a naturopath in 1985, graduating from Bastyr University here in Seattle. And you've gone on to do so many things. I'd love for you to share your story of what led you to become a naturopath, and then also what led you to become the naturopath you are today.
Yeah. So, what's interesting, Ashley, this is so much a truth relative to my generation of naturopaths, more than a lot of the younger ones today. And that is most of us older naturopaths, our story relates to our own health and our own discouragement with the modern medical paradigm that was available. So, I have to go all the way back to my birth. I was a premature baby in an era when preemies often didn't survive. And my parents were told that I was going to be one of those that didn't survive. And my parents decided that's not going to be the case. And they set up an oxygen tent in our home. And my mom and dad and my two sisters basically sat with me with an eyedropper 24/7 to nourish me and hug me and try to keep me alive. And they obviously succeeded. What happened, though, is when you're a premature baby, the weakest link that you have physiologically, anatomically, is your lungs. And so I've always had really weak lungs. And growing up as a child, I always had chronic sinusitis, rhinitis, bronchitis, asthma, and I would usually end up in some type of respiratory crisis 3 to 4 times a year, requiring significant allopathic traditional medical interventions. And historically, those interventions didn't do a lot for me. They didn't help me. And I was just always gagging and coughing. So what happened for me is I'd never heard of the word naturopathy or naturopathic medicine or natural anything. In the 60s, I was going to a private high school in Sedona, Arizona, of all lovely places, called VVS, Verde Valley School. So in the 60s, get this, there were a group of kids at this school that were vegan. And I didn't know what that meant or was, and I didn't necessarily attracted to that. I mean, I grew up on meat and potatoes and as much milk as I could drink, um, and but I noticed actually that this group of kids, I mean, they were kind of the movers, the shakers, the doers, and I really wanted to interact with them. I wanted to talk to them. I wanted to kind of hang out with them, and I discovered very quickly that the easiest place to do that was at the meal table, because we had 3 squares a day in a hall where everybody ate together, right? It's a boarding school. And so I asked them, I said, look, I want to hang out with you guys. Can I eat with you? And they said, no problem. You just can't bring any of your animal products to our table. And so I kind of scratched my head and went, oh, well, okay. I figured, what the harm? You know, it's like I didn't figure there was any value there, but I didn't think there was any harm. So what happened for me is about 3 months into that, I woke up one morning and something was different. Something had changed. And I was trying to figure out what it was. And all of a sudden, it dawned on me that I wasn't coughing, I wasn't hacking, snorting, sneezing, gagging, and taking medicines or using inhalers. And I thought, wow, could my diet have anything to do with my chronic, lifelong respiratory problems? And it seemed that maybe it did. And so I decided to set up a trial for myself, and I started reintroducing animal foods into the diet. And what I discovered is when I introduced dairy, that I immediately started gagging and coughing, and I mean, it grabbed me immediately. And I thought, wow, you know, am I allergic to dairy? I mean, dairy, this is the most wonderful food on the planet, isn't it? You know, that's what we're all taught. It continues to be taught. You know, we're irresponsible parents if we don't give our children milk and dairy products, right?
Right.
But this is a fallacy. Dairy is the number 1 allergen on our planet.
Mm-hmm.
Number 1 allergen. And I'm sure you've heard this from naturopaths many times, but it bears repeating. You know, naturopathy is a discipline that looks to nature. And if we look at nature, one of the things that we observe is that all mammals nurse species specific, and then they're weaned.
Right, you don't see a dog nursing a cat. You don't see
exactly.
You don't see
exactly.
Yeah, you don't see a
Species
horse nursing
specific.
a cow.
So based on that, what's true is that humans should consume human mother's milk until weaning, and then they should be weaned like all other animal species do it, right? So because humans are clever, and because we know that milk is one of nature's most perfect idyllic foods, that we think, oh, well, then use milk. The problem is all of that information is true for the species to which it is intended and not cross species. So if you look at the biochemistry of milk, you'll see that human milk, as differentiated from cow milk, that the protein content, the mineral content, the enzyme content, the fat content are diametrically opposed. Cow milk is one of the worst possible choices we could engage. Goat or sheep milk is a much better analog, but even that, for someone like myself, doesn't work because I have a very high level active allergy to dairy products. And I proved it to myself. You know, this is my freshman year of high school in the 60s. And I went back and forth. I played with this. I really wanted to nail this. And I discovered that dairy was my absolute nemesis and I couldn't use it. And I really enthusiastically called my parents and doctors. I mean, my parents, very well educated, took me to the best doctors in the country, went to Sloan Kettering, went to Mayo Clinics. And at no time, Ashley, at no time did any physician I ever went to ever suggest the possibility that a food could in any way be impacting my respiratory tract or have any influence on my health. So I was really excited to share this newfound knowledge to these people. And what happened, as you might imagine, is both my parents and the doctors said, oh, isn't that cute? That's silly. And you do know that children with asthma outgrow it. Right, you know that. So you've outgrown it, and it's wishful thinking on your part. And I said, no, you don't understand. If I start drinking milk, in 3 days, I can end up in the hospital. I can do it over and over and over. And if I stop it, I'm okay and I don't need any medicine. So you can't tell me this isn't really important. So at that time in my life, actually, I started studying and researching nutrition and herbs and natural things. And I was engaging it for myself, engaging it for my friends, and family, loving it. And never in my wildest dreams thought, there's actually a profession that you can involve yourself with called naturopathic medicine that actually teaches this at physician level training. I didn't know naturopathy existed, I said, back in those days, or that there was a possible career choice. And I was, kind of interested in medicine, but I looked at medicine and it was like, it's like, no, it's they make you do things in medical school that I was aware from the get-go that candidly expelled. I mean, when they want you to do spinal taps on babies and give, intravenous steroids and antibiotics, I wouldn't do it. Now, that said, I've been in practice 35 years as a naturopathic physician, and I have a very healthy respect for allopathic medicine and allopathic drugs, surgery, and procedures. Right here in Tucson, I'm just blanking on the name. The most famous alternative MD, in the nation is right here, Dr. Andrew Weil. Mm-hmm. There we go. Mm-hmm. Andrew coined the word integrative, mm-hmm. right? That's his word, integrative. It's an integration of allopathic, modern medicine, and naturopathic, nature cure. And this is where the rubber meets the road. I mean, we've got to join the best of these two fields. I specialize in chronic degenerative disease. I am particularly specialized in alternative cancer therapy. And there's times where a short burst of chemotherapy, for example, in the form of what we call IPT, mm-hmm. insulin potentiated therapy, mm-hmm. where we use a very, very low dose of chemotherapy using, this is a very, very clever paradigm. The reason that chemotherapy works at all is because of a couple of facts that we know about cancer. Cancer is an embryologic disorder. So cells of our own body that are embryologic in nature are proliferating out of control. The body is attacking itself. We know that embryonic tissue is fragile, right? It's more fragile than adult normal tissue. That's why we tell a pregnant woman that she needs to be very careful about, what she's doing to her body during the pregnancy because of the influence on the fetus. Mm-hmm. So the formula in chemotherapy is we give a very toxic agent that preferentially kills cancer cells over healthy cells because they're more fragile. Your audience needs to hear this. Cancer, which is often thought of as this incredibly strong, powerful thing that takes over, no, that's the wrong image. Cancer is actually extremely weak and fragile. Really, it's weak and fragile because it's embryologic. So we use chemotherapy, kills cancer cells. The Russian roulette is, will we kill enough cancer cells before we kill you, the host, that you will survive and the cancer won't? It's a bad trade-off. IPT, the insulin potentiation therapy, somewhat mitigates that by giving low dose, but by using insulin, what happens is we drive blood sugar down and then we mix the chemo with a sugar solution so it gets preferentially sucked up by the body.
Oh, very cool.
The result is that all the chemo goes right to the cancer cells and no healthy cells, and it just wipes it out. Now, all of that said, sadly, IPT is not a standard of care in allopathic medicine, and where traditional chemotherapy that can cost tens of thousands, hundreds of thousands of dollars to implement, the IPT is out of pocket because insurance won't cover it because it's considered alternative.
What? So it's more effective. It's more effective, but they're not going to cover it. That doesn't make any sense.
More effective, significantly safer, and less expensive. All of the right things, and we can't get it on the map. But we have the same problem actually with, I do a lot of intravenous vitamin C at high doses, and vitamin C, when we start pushing what we call tissue saturation levels, which is pushing 75,000 milligrams or more in a single bolus intravenous infusion, is chemotherapy. Vitamin C at that concentration is not an antioxidant, it's an oxidant. But it causes no damage to healthy cells, and cancer doesn't like it.
So the cancer is weak, and that level of vitamin C isn't necessarily harmful to a healthy cell, but it's going to be disruptive enough that it could potentially harm the very weak cancer cells.
Exactly. So, with something, so again, as a naturopathic physician, here's my model. When we always want to try to do natural therapeutics, and we may want to do aggressive natural therapeutics if we have serious pathology. But if something isn't working, then thank our lucky stars, we have the allopathic medical system to fall back on to try to get us to a point where then maybe the natural modalities can take effect. This is a paradigm being somewhat perpetuated by Cancer Centers of America, where they now have naturopathic physicians on staff in every facility doing integrative medicine. Unfortunately, they're not doing aggressive alternative medicine. They're just doing integration. And that's a very important first step. In a clinic like mine, we do aggressive alternative therapies. So although I like things like the vitamin C, I'm one of a small number of clinics, that number's growing, where we do things like ozone, blood infiltration, and ultraviolet blood irradiation.
I'm so excited to hear you say that, because I did not know that we could do that in the United States. I first heard about ozone blood infusion when I learned about the HIT Center in Tijuana. And
right.
And my friends went there, and my friend had cervical cancer, and when she left, she didn't. And it was one of those, like, what she described was the ozone kills off all the viruses, bacteria, fungus, everything that's not healthy in your blood, and all of a sudden your immune system, which has been kind of keeping everything at bay your entire life, is now free to 100% focus on killing the cancer, because you've removed every pathogen from your body. Because after we have a cold, it's not like the virus leaves us or the bacteria leaves us. It's just our immune system's figured out how to manage it. And so literally every illness and every virus and bacteria we've ever been exposed to is still in our body, and our immune system's always fighting it. Is that an accurate description of what ozone therapy does?
Well, it's part of it for sure. I mean, let's say, as far as we know to date, there is no pathogen on the surface of the planet that can resist ozone in adequate concentrations. But ozone's a fairly toxic substance, so we have to, like any other substance, we have to be careful with exactly how much of it we use. That said, we know and understand ozone really well, particularly because of Europeans and particularly because of German physicians who have put ozone therapy and ultraviolet therapy on the map. I mean, they have more than one full medical journal dedicated to nothing but ozone and ultraviolet blood. So we know a lot about this and how to use it safely. And yes, inside the body, it decimates pathogenic organisms. At the same time, because cancer cells are embryologic and fragile, it tends to kill cancer cells directly. So it's not just killing off other pathogens and then helping them strengthen the immune system. It's actively killing cancer at the same time. So Arizona is unique, Ashley. Arizona has the best scope of integrative alternative medical practice in the nation. So we can do things here that in many other states, you can't get the therapies we can offer under the Naturopathic Board of Medical Examiners. So a lot of people that go to Mexico don't realize they don't need to go to Mexico. They can come to Arizona.
Wow, that's really exciting.
And there's some things that I do that are really unique. When we're talking about ultraviolet blood, I'm working with some technology it's some first phase research, but we're doing a broader based chromotherapy modality where we're using different frequency bands of different light spectra, not only in the ultraviolet range, but in the visible and non-visible ranges concurrently. And I think, as someone like Einstein said that, that the medicine of the future, will be, light and sound. That those two, and I may be misquoting, it may not be, but it has certainly been said and suggested. And I'm starting to believe it based upon my own personal clinical work and research. So I'm working with a machine that there's only 4 of in the world presently. And we're dealing with, one of the pieces that we're doing is we're actually now able to take fiber optics and insert that right into the bloodstream, into a blood vessel, and then generate these different color band frequencies, light spectra, right in the blood directly. So historically, we've taken the blood out, and then we ozonate it, and then we put the blood back in through the ultraviolet and other light quanta. But we're still doing that, but we're now developing technology to do it directly without having to take the blood out at all.
What does it do? So what's the benefit of putting these light and energy frequencies directly into the bloodstream?
So one of the factors, and this is something that we've really, learned from our allopathic colleagues, and that is the phenomenon of particular light frequencies actually potentiating certain drugs. That they're now doing therapies where, this is again particularly in something like cancer, where they administer a chemotherapeutic agent and then use a particular light frequency that stimulates it once it's inside the body to then more effectively kill cancer cells. So they're tending to do this with very toxic things. We're doing it with things that are extremely non-toxic and yet still clinically very effective.
And what kind of results are you seeing?
Well, here's what's true. If you know about naturopathic medicine, and you do, and your listeners are learning more and more, our paradigm is that healing is an integration of mind, body, and spirit. So the implication that there is a magic bullet, that we're going to, quote, find the cure, whatever that might be, and it's going to come in the form of a particular therapy, at some level is neither logical nor even rational. So we're finding powerful therapies, things like ozone, ultraviolet blood. Again, I've been doing this 35 years. What I found is that all of my patients with cancer live longer and have a better quality of life than they would have had. Now, in some cases, I mean, give you an example. Early in my career, I dealt with a gentleman with squamous cell carcinoma. And squamous cell is a skin cancer that's extremely aggressive and virulent. And this thing attacked his left eye. And when he came to me, his eye was bulging half an inch out of his head. Oh. And the whole side of his head was swollen and distorted. And he said, this is a man in his 20s. He said when he came, the regular doctors have told me that they have to cut out my eye and cut away half of my face, and then they're going to poison me with radiation and chemicals, and then I'm going to die anyway. But they want me to start immediately, and they guarantee me I will not survive. They guarantee it, but they want to start immediately, right?
Of course they do.
because they might give, he said, they might give me 30 more days that I wouldn't have. And he said, so I've come to you. He said, I don't want it. I don't want to lose my eye. I don't want to, go there. So I just started applying some of the tools that I use, and the bottom line is that we saved not only his eye, but we basically backed this whole thing off. And rather than living 30 days with no face, he lived for another 10 years.
Oh, wow.
With metastatic squamous cell carcinoma that's invaded the eye and probably part of the brain, that is unprecedented.
And was it good quality of life, or I mean, did he, because you were helping him be as healthy as possible, he was able to see and function and live life?
Yeah. Oh, yeah. I mean, he actually came back virtually to normal for the first few years. And then the truth is he didn't end up coming back to me. He was moving and traveling. And so wherever he went, whatever he did, finally something caught him. But we might have brought him back a second time.
Mm-hmm.
Another example, again, early on, I had a woman with a glioblastoma, and this is a brain cancer. And glioblastoma and other brain cancers are becoming more and more prevalent and prolific. And one of the reasons is the reason that, Alan Bell stories, it's about xenobiotics. It's about chemicals and different radiation waveforms that we're inducing on our planet that are damaging our bodies, damaging our immune systems, inducing disease, particularly in the category of autoimmunity and cancer. And one of the biggest problem areas are cell phones. The fact that we give our children cell phones and let them hold them and play with them and put them up to their head, this is an unbelievable travesty, Ashley. We need to snap out of it and stop bringing cell phones anywhere near our head. If we don't stop doing this, you can't. We often frame things from a natural perspective, different vectors of inflammation or disease as functional or dysfunctional. Let me give you a simple example. A functional stress is you get a scratch on your finger. You don't do anything to it. It heals just fine, right? You with me? Mm-hmm. It's fine. A dysfunctional stress is, you work in a coal mine, you don't use a respirator, you get lung disease, right? Mm-hmm. Now, as naturopathic physicians, we can give them vitamin C and we can give them echinacea and we can do all kinds of wonderful things. And guess what? It won't work. If they're working in a coal mine, they're not using a respirator, it won't work. They need to use a respirator or they need to change jobs. Not to say that using vitamin C and other things isn't relevant. It's just to say that if we're dealing at a mind, body, spirit level, that we need to take this step back. Mm-hmm. And we need to think about what we're really doing. So this is the problem with cell phones. They're a dysfunctional stressor. And I'm not aware of any technology that we're developing that's diminishing the toxicity and the radiation waves of these machines. In fact, they're worse. Mm-hmm. Alan in his conversation might have talked about using a flip phone, the old style flip phones mm-hmm. versus the new, super designer phones. The problem is there is less radiation from those more basic phones, but they're still dangerous and not safe. Period. They're just all dangerous and not safe.
Mm. And what if, do you recommend they just use earbuds if they're going to use a phone anyway, or keep it as far away from their head as possible?
So what I tell people is that, you want to get the best shielding technology that you can. And I'm sorry, to date, and I've been searching, I haven't found any technology that I'm satisfied is adequate. The different Faraday cage materials that will shut the signal to the phone off if you put it in a Faraday cage so it can't receive a call or call out from. I can tell you that even when a phone is in those cages, that I can feel a disruptive energy still coming off of them. Mm-hmm. So there is some waveform. It may be a level of waveform that we haven't even identified. We talk about EMF, electromagnetic fields. Mm-hmm. And I don't know what part of the field is causing the problem. But there's something that's going on and something that's going on, I think, that we have yet to have the science to even adequately, quantify it. But using a Faraday cage, using a Faraday-based, material that can wrap around the phone, Bluetooth, the wireless tools are even more dangerous than the phone itself. And of course, you see people wearing these things all day long on their head, right? They think it's cool or something. I don't know. Really dangerous. And a simple earbud, although it converts the signal from a digital signal to an analog signal, it's safer. It's not safe enough. So the only technology that I approve of that really works is an earbud, where it converts the signal. So this is a plug-in right into the adapter on the phone. It converts the signal from digital to analog to air.
Mm-hmm.
So there's actually a part of the tube that is nothing but an empty, hollow tube for air flow through, and that's where the sound transmission goes. As long as you have the phone attached to that in a partial Faraday cage, as far away from your body as the cord will let it reach, that's the way I use a cell phone.
Oh my gosh. It's kind of like the earbuds remind me of the old school headphones you'd have in airplanes,
Yes.
Back, I guess I'm dating myself, but back in the 80s and I guess the 80s, I think in the 90s they changed, but back in the 80s, there would be, they were hollow tubes and you'd plug it into the side of the seat and then sound would come through the tube. So that's like, they said, like
that's
air.
right. That's right. Yeah.
Right. My cell phone just died recently, and so I went and got the latest Samsung phone. And I've been learning to listen to my gut. My whole life has been realizing that my gut was right all along, and then I didn't listen to it, and something bad happened. And if I listen to my gut, something good happens. And I was just feeling so unhappy about getting a new phone. And sure enough, they turned it on, they handed it to me. I held it in my hand and it made my hand hurt. It ached. And it was
That's exactly right.
I could feel something emanating from it, and I didn't say anything. I handed it to my husband, who's also very empathic and very tuned in, and he was, "Oh my gosh, this is like negative energies coming off this. What's going on?" And I was like, "Exactly." And it turns out that the latest phones have this weird technology where you can just place it on a charge pad, and the battery can suck up energy when you place it on charge pad, and it's emanating something that it actually hurts to hold my phone.
That's correct.
Which is
so you, Ashley, to your credit, this, okay, there's degrees of sensitivity, and someone like Alan Bell, MCS, multiple chemical sensitivity, where even smelling a little perfume across the room can cause him to go into a grand mal seizure. For most of us, synthetic perfume across the room makes us kind of curl our nose up and go, yuck, I don't like it. It's not, that doesn't smell beautiful. It smells like chemicals, right? It's weird. And then there's higher levels. Then there's the people that, oh, no, they smell it and they start sneezing, or they smell it and their head starts to feel funny and they feel woozy, right? I mean, the more in touch we are with our bodies, the more in touch we are with energy, the more we feel, and then can discriminate things that we should be bringing into our field versus things we should leave out of our field. So if someone can hold a cell phone in their hand, in their bare hand, for an extended period of time and say they feel nothing at all, then their sensory apparatus is plugged up. It's contaminated. They need a good cleansing. and let me tell you, one of the key pieces of that cleansing is a commitment on a daily basis. This is a take-home piece for our listeners, what I call grounding. So people have sometimes heard of this concept because of Ober's writing the book called Earthing. You're familiar with that? Mm-hmm. So this is a brilliant concept. The earth generates a field of energy. And think about this. Not long ago, every single human on this planet was grounded in contact with the earth 24/7, right?
Mm-hmm.
24/7. Whether they were in a cave, in a tree, it didn't matter. Literally 24/7. It's only in modern civilization that we have discovered a way to make a disconnect from this energy field.
Mm-hmm.
And remember that the human body is mostly a sack of water. And I'm quoting Star Trek, and I assume that some of your listeners might be Trekkies. I admit that I am.
Oh yeah, me too.
And so you may recall when they finally got the universal communicator working for the first time, and Captain Kirk is talking to the crystalline entity. What the crystalline entity says is, "Oh, you ugly bags of mostly water," right? That's what he calls. And of course, you and I know that yes, it's true, but we think of ourselves as beautiful bags of water, right? But water is this very conductive material.
Mm-hmm.
And so if we're wearing plastic or rubber bottomed shoes, then we are disconnecting from the cross energy interface between the planet, the earth, and our bodies.
Mm-hmm.
And
driving
merely,
in a car, right? Driving in a car with the rubber tires, or being in a high rise, or flying in a plane, or living in a 3-story house or something. I always, it's funny, it's weird. I'd be lying in bed as a child, so it's something that's been with me a long time, and I'd think to myself, I'm not near the ground. And I'd think, even though I was on the first floor, we had a basement, and I would think to myself, how far is it for my body to reach the ground? And these are thoughts that would come in my head as a child, because I would always remember that going camping, I'd have the best sleep, like just, and you think you wouldn't,
Mm-hmm.
It's like cold,
Right.
damp, lying on the ground, like how, that doesn't sound very appealing. And yet the sun would go down, and I could fall asleep, and I'd wake up with the sunrise and feel like $1,000,000. And then knowing that when I go, living in different homes or apartments or condos or whatever, I'd always ask myself, well, how far away am I from the ground now? Like how grounded could I possibly be
Right.
if I'm 50 feet from the ground?
Yeah. So follow this. Think about this a moment. Personally, we all do, people, and some of them may be in our own families, that have literally stopped touching the earth. Completely stop. Follow this image. They wake up in a metal frame bed. They flip their feet over and step on their synthetic carpet, and then they slip on their rubber bottomed slippers. Then they go and do their thing. They come back, they get dressed, they put on their rubber bottomed work shoes, play shoes. They go into the garage. They get into this metal box with 4 spinning rubber discs that go woo, woo, down the road, creating a higher and higher static charge. And then we get out of our cars. And for example, my office in Tucson, Arizona, it's a complex of single-story offices. There's about 60 of them here. And, there's a central parking lot. It's a nice standard asphalt parking lot. So you park your car, you get out, you walk across the asphalt with a rubber shoe into my office, as people do. Right? They leave their shoes on all day. They go to lunch. They leave their shoes on. They come back. They get in their car. They may have smelled the air. Yes. They may see the light and the clouds and the trees. But at no point in the day, not one point, not one moment, did they touch the ground or touch a tree or touch anything else. Right? It's like they're touching their metal chairs and desks and computers. And then they go home and they do the same thing. So here's what's really amazing and interesting. And I contend that we would need to do the research. We don't want to be part of this experiment. But I contend that the only, Ashley, that those people even have life, even exist at all, that they can continue to survive, is because of using running water. When you turn on the tap in your bathroom to wash your hands, or you go in the shower, the water is coming through pipes, usually coming through the earth. So the water is grounded. even if that water is traveling to the 100th story of a high-rise building. And so when you stand in running water or just wash your hands in running water, you're grounded right to the earth, at least for a brief period of time. And that brief period of time is just enough to keep the life force operating so we can operate a body. But if you shut it off completely, I believe we would actually shrivel up and die, that we would be incapable of sustaining life.
What about astronauts?
So astronauts, as you know, are shriveling up and dying.
Yeah.
We have a complex problem with zero gravity. We thought that if we simply put astronauts in zero gravity and then used resistance training for exercise, that we could, for example, sustain the integrity of the bone matrix. It doesn't work. They lose bone mass. So what we've discovered, or what NASA discovered, is, and these are clever people, is they dialed in a particular mechanical physical vibration that they have the astronauts now. They have to basically sit, hang on this machine in the space cap, in the places, and they're basically vibrating.
Is that
and
was that technology? Did you know what the name of it is? Is it called Beamer?
I don't know. I don't know. I mean, I think that might be something else. But it's. I mean, you can buy these. I mean, they're used in medical facilities. It's one of the best technologies for helping osteoporosis. So, and I prescribe them for patients, and so you can get it as a medical device.
Oh, really?
But they literally, it's not like, there's all kinds of machines, that vibrate that are massagers, right?
Mm-hmm.
It's not the right frequency. Mm-hmm. This is a different frequency. So again, this principle that light and sound, which is a band wave, which is a frequency form, that, frequencies and the differentiation of frequencies in their many and varied forms is one of the keys to medicine in the future for all of us. And this is where natural and the synthetic can really meld together. We can create machines that can create frequencies that can emulate natural frequencies to induce health.
I hope you're enjoying this interview so far. We'll get back to it in a minute, but first, I wanted to share a message that has been on my mind to bring to you. I started this journey because I wanted not only to help you experience amazing health, but I wanted to find it myself. And what better way to find something than to learn from experts and also to teach it. Through this last year of doing the holistic podcast known as Learn True Health, I have had the honor of connecting with over 100 experts in the field of natural medicine. One thing that's really inspired me is there's a group of people, in fact, it's the fastest growing career field in the United States right now, and that is health coaches. I didn't really appreciate them or understand what their role was until after I started interviewing enough of them. And I found that health coaches have an amazing ability to impact someone's life far beyond what medical doctors are doing right now. You might see your medical doctor once you're already sick, right? The old paradigm of healthcare is to go to a doctor when you're sick, wait till your body breaks down or show signs of symptoms, and then you need a doctor's intervention. Not many people, now maybe you do because you're smart and because you're a Learn True Health listener, you probably do this to some extent. Go to a doctor on a regular basis and get great health advice from them. Do you go to your doctor and they say, hey, I noticed that you could really use more vitamin C, and I think you should eat this. And I really think that based on your body weight and based on your blood work, that a few more minutes of cardiovascular exercise. And here, why don't I go ahead and show you how to do it? Why don't I go ahead and, I've got some recipes that are really going to help you, because I see in your blood work that you could really benefit from these nutrients. Why don't I go ahead and spend an hour with you and help you do that so we can get you on the right track? No medical doctor does that. And if they do, God, hold on to them and definitely tell everyone about them. I don't know any medical doctor that has the ability to sit down with you on a regular basis and not only find out about your lab work, but also find out about your health in every aspect of your life. You see, if you have a really, really stressful job and you have no outlet for that, that can bleed into other areas of your life and lead to ill health, right? So what I'm learning about health coaches is that they help their clients to gain balance and holistic health in every area of their life. They come to you wherever you are, whether you're still eating McDonald's and you're 400 pounds and you're sitting on the couch, whether you're driving a truck and you just don't have time for exercise and you really do want to eat healthy, but you're always like 100 miles away from any Whole Foods, or whether you're already gluten-free and already eating organic, and you could just really use some extra advice to take your health to the next level. Wherever you are, a health coach meets you where you are. And then what they do is they slowly add step by step the most powerful but manageable changes slowly that make the biggest difference in your life. And they help you to find out what it is that you need most that's going to make the biggest difference in your life. And so the more I learn about health coaches, the more I realize that we need more health coaches in the United States, in Canada, in Europe, in Asia, in Australia. We need more help, this kind of help where someone can be our health advocate, where they can hold our hand, where they can take the time to slowly teach us the things that we wish our parents and our grandparents had taught us. The things that we wish we had learned in high school, the things that should be taught in home ec, right? And unfortunately aren't. The lessons that we want to learn so that we can pass these lessons on and these healthy habits on to our children and to our future generations. Now is the tipping point. You may have heard the scary statistic that our children's generation now has a smaller life expectancy than we do. Can you imagine if we're meant to live to be, for example, 75 years old, our children might only live to be 68? This is very scary. The fact that diabetes and prediabetes, 1 in 3 people have blood sugar issues. The scary statistic that 1 in 2 men in their lifetime will experience cancer. 1 in 3 women in their lifetime now will experience cancer. These are statistics that need to be stopped, and only you can do that. So, if you're the type of person that knows that you could benefit from it, I highly recommend checking out a health coach. Now, I am actually in a health coaching program, becoming a certified health coach, and in 6 months I will be a certified health coach. And I am absolutely loving this program. I'm halfway through the program, and I'm sending this message to you, not only for those who want to make changes in their life, but I know there's a listener out there who is looking for a new career, who's looking to shift their life. Now, the Institute for Integrative Nutrition was started over 25 years ago by Joshua Rosenthal. You can go back and listen to my interview with Joshua Rosenthal, which, he is my hero. He's absolutely amazing. I recommend listening to his interview. He started this actually for women. Now, he has men in his course, and I love seeing and hearing that men are getting into the health coaching field. But Joshua actually started the Institute for Integrative Nutrition for women because he saw that there was an imbalance in the workforce, that women had less opportunities 25 years ago to be able to live their passion and be mothers and maybe work from home. And as a health coach, you can do that. You can still be a mom. You can still have a career. You can still be a full-time mom. You can still homeschool. Whatever you want to do, you can fit health coaching into your life, however you see fit. It's amazing. what I also love about Institute for Integrative Nutrition is that they also have a business courses. So not only are you learning how to be an exceptional health coach, but you're also learning how to hit the ground running however you want, whether you want to do full-time or part-time, whether you want to take on 1 client a week, a month, whether you want 100 clients. They teach you how to structure your business, how to market yourself in a way that comes from your heart, comes from authenticity, comes from integrity. I have never been more inspired by an institute in my life. So for the listener out there that has been seeking, that has been looking for their life purpose, that when they think about the possibility of helping someone, of helping people, they get teary-eyed. You know, every time I think about people who are hurting, that I could impact their life, that I could help them, I just start crying. Tears of joy and inspiration. I want to help people. And so if you, like me, are inspired by helping people, and you really are passionate, you don't have to know anything. You don't have to know anything about health. You don't have to be an expert. That's fine. You don't have to have a degree. You can start as a student with the Institute for Integrative Nutrition, and they'll teach you everything you need. And you can do it in your spare time. Do the course in your spare time while you're a full-time mom, or while you're working full-time, or whether maybe you're still a student. I love how they really organize, and they spent years. I mean, they've been teaching it for 25 years. They've organized the material. It's all online, so you can be anywhere in the world. There's students all around the world. So if you're the listener that I'm talking to about wanting to shift your career or add to your career, maybe you're already in the health field, you just want to increase your knowledge, or maybe you just have a calling and you want to try it out, please check out the Institute for Integrative Nutrition. Go to their website. It's IIN, Institute for Integrative Nutrition. Check them out. Give them a call and ask for, you can get a download to their course, their curriculum. You can even do one of their classes for free to check it out, to see if it's a match for you. When you go to enroll, mention you heard it from me, Ashley James, Learn True Health Podcast, because I have aligned myself with them to make sure that you get a special. I want to hook you up. Any of my listeners who go through their program get a special from the Institute for Integrative Nutrition. And also, I want you to tell me. I want you to email me, ashley@learntruehealth.com. Join our Facebook group. You know, just search Learn True Health in Facebook. Join our group. I want you to contact me and tell me you're going through the program. I want to support you in your success. If you have any questions, or you just want to tell me how amazing it is, I have some great listeners that have already gone or have begun going through their program, and they all love it. And I love creating this community. So if this is something you think would be interesting to you, even if anything I've mentioned is remotely interesting, if you go to learntruehealth.com, on the sidebar, you'll see halfway down, just scroll halfway down, you'll see that there's in the widget section a place where you can click to get more information about the Institute for Integrative Nutrition, or just go to their website. Their website was so impressed me because you see all of the teachers that teach their course, and you begin to recognize their names, and you realize that these are all sort of heroes in the holistic health field, and you can't believe that you're going to be learning from them. It's been a dream come true. And I've had some of their teachers on the show already, and I'm going to have more. I've scheduled some to be on the show in the future. So thank you so much for taking the time to listen to my message. I wanted to take the time to give you this information because I know that there are some listeners out there that are looking for this change now. And they're looking to shift their career to help people, to that they genuinely want to make a difference. We want to shift the message from the old paradigm of wait till you get sick and then go to a doctor and get a pill, to shifting our lifestyle. So we're living the most authentic, healthy lifestyle possible, so that we can have a life that is vibrant, that is full of energy. We can have health freedom. Right? Don't we want to wake up feeling like we're 18 years old every day, no matter what? And we can have that. So if you want to have that for yourself, get a health coach. Definitely get an IIN health coach. If you want to learn how to do that so you can do it for yourself and help others, definitely check out taking the Institute for Integrative Nutrition's health coaching program. It's a certification program. I highly recommend it. And if you have any questions, absolutely feel free to email me. Excellent. Well, enjoy the rest of this interview. That is so fascinating. Let me just take you back for a minute, because I want to paint the full picture. So you were there in that moment where you realized you could turn on and off your health problems that you'd had your whole life because you had weak lungs as a preemie, with simply changing one thing in your diet. And,
Yeah.
and what happened? So you went from that. How did you discover naturopathic medicine? And then how did you decide, what was the series of events that led you to want to focus on these types of healing modalities for cancer?
So, um, it's so interesting, Ashley, how we all have this innate ability to look at those around us and often kind of see their natural inclinations as well as their inherent weaknesses, right?
Mm.
And that we, looking at ourselves, don't see it, and so it wasn't until it was, let's see, my junior year of college. I was going to Evergreen State College in Olympia, Washington, and I met my wife there, who was studying organic farming and was the strictest organic vegan I'd ever met in my life.
That's so awesome.
and I was trying to, I wanted to cozy up to her, so I was trying to emulate, what she was about, and she really turned me on to naturopathy and kind of said, this is what you already do and what you probably should do, and there's an actual profession you can get into that does this. And I went, really? I mean, in Olympia, Washington, I still hadn't heard the word naturopathy. I'd never heard this word, right? Never heard the word. I mean, unbelievable. But so I decided to finish up my pre-med, and then I went to Bastyr, and I graduated in '85, and back then, I had the privilege of working with a colleague that had an office in the Bellevue area that was specializing in chronic disease, and particularly cancer. And he was doing IV, natural substances. And when I went to Bastyr University, nobody taught us about intravenous anything. I mean, in the early part of my profession, there was a very strong schism between, those who believed that nature cure, did not involve the use of a needle under any circumstances, versus those who contended that no, we could use needles as well if we're doing natural things. Mm-hmm. That schism still exists in my profession, mm-hmm. But there's more of a recognition that with very sick people, I mean, I would love to tell you, Ashley, that if you have metastatic cancer, that you can cure it by, eating organic food and, walking on the grass and meditating. My experience has not borne that out. Mm-hmm. I've never seen anybody capable of doing that. It may be possible. But what I've observed is that our bodies seem to need a little more help than that. So from the very early part of my training and my practice, I was committed to working with degenerative and chronic disease, and I was committed to researching and developing most advanced integrative therapeutics available whenever I could access them. So I've been on this path, from the get-go. So back in the early years, I was one of the naturopaths trying to teach other naturopaths intravenous medicine and nutrient IV medicine and ozone medicine and whatnot. One of my pet kind of peeves has always been that when we can develop injectable grade medicine derived directly from herbs that we will see a radical change in the healthcare of the entire planet. And in the 35 years I've been in practice, this has been very interesting and candidly disconcerting, is the number of herbs readily available in an injectable grade form to administer to patients is almost none. I mean, the Chinese have done more work probably than any other nation in developing injectable herbal medicines. But even there, it's been very, very remote. So the handful of herbs that we can get, things like echinacea and licorice, for example, these are powerful herbs. Mm-hmm. And they're very powerful when they're used intravenously. But that's not very much. Our pharmacopoeia is so much greater than that. So one of my passions is essential oils. Mm. And it's interesting how, essential oils are really gaining in popularity, particularly in the United States, primarily because of a couple of network marketing companies, mm-hmm. Which happen to have extremely high quality, good oils. Mm-hmm. I don't like network marketing, but I like the oils that these companies produce. And it was actually at one of the annual medical essential oil conferences held here in the U.S. that I was presenting a paper at, that someone brought up the use of essential oils intravenously. Ooh. and said that there's a clinic in Costa Rica that's doing this. And that really got the bug in my ear. And I realized that this was the answer I was looking for. So I started doing my own research and have a kind of a team that I've been working with over the last couple years. And the problem, essential oils are by definition the purest extract of an herb that you can get. Mm-hmm. It's extreme, and exactly what the chemical molecule breakdown is very clear. There's more research on essential oils and what they do metabolically, clinically, probably than all other herbal medicines combined. There's just a tremendous body of research. Again, it's all in Europe. Most of it's in French, but this body of data is growing. So the problem is how. When I was in naturopathic school, we were taught nothing about essential oils. Mm. And the main reason is because, at least in the days that I went to naturopathic school, there was a strong emphasis on homeopathy. Mm-hmm. And if you're familiar with homeopathy, and I'm sure lots of your viewers are, there's a principle that homeopathic medicine can be antidoted by using strong aromatic substances, mm-hmm. right? Mm-hmm. So we tell a patient, if you're using a homeopathic remedy, stop using your peppermint toothpaste, because if you use your peppermint toothpaste, the homeopathic remedy won't work, mm-hmm. right? Mm-hmm. So I have always had a problem with this premise. So one of my homeopathic mentor teachers, when I was in naturopathic school, I remember one of his lectures in which he boldly stated that homeopathic medicines are not as fragile as most homeopaths around the world insist that they are, and that if they were that fragile, if they could be thrown off that easily, then the truth is they would never work, because nobody would ever be in a position to use them correctly.
Right, because they travel. I mean, the homeopathic medicine I get, I think, comes from someplace in Europe, and it's exposed to all kinds of temperature, and as it's traveling, exposed to different electromagnetic radiation, right? Because you're not supposed to keep homeopathic medicine near a cell phone or near any electrical outlet or whatever, and it's just you don't know the chain of custody, and it could be also sitting on a shelf for however many years, because it's not like it goes bad. And then you go to use it and it works. And I mean, I'm such a believer in natural medicine, but I'm also have this really crazy skeptical side. And so I was actually traveling with a naturopath, facilitating health talks when I discovered I was pregnant. Now, I was told when I was 19 I'd never get pregnant. And then with natural medicine, completely natural medicine, we conceived. And I thought I was sick because we were driving actually to do a lecture in Portland. And I had a migraine. I couldn't see straight. I was sensitive to light. I was sensitive to smell, which was the dead giveaway. And I was throwing up, and I had a fever. I never had a hot flash in my life, so I thought I had a fever, and I was miserable. I thought for sure I have food poisoning, and I was in so much agony that I said to my husband, I had him pull over, and I said, I really normally don't go for like over the counter medications, but at that point, I needed an Advil or I needed a bed to lie in, and so I said to him, honey, I need to go to the drugstore, because I need to buy a pregnancy test, and again, you have to remember, I was told I was never ever get pregnant, but I was taking natural medicine for healthy, hormone balance anyway, right? Because why not?
Right.
And I said, I really need to take some Advil right now. But before because I would never poison my body if I knew I was pregnant. I said, but first I have to take just in the off chance I'm pregnant. I need to, and sure enough, it was in a town in between Seattle and Portland. I come out of the bathroom just screaming and crying and jumping up and down, and of course I didn't care at that moment that I had this like throbbing headache, and I was feeling like nauseous, and I had a high temperature, and I had every symptom which has ever been described as morning sickness, and it was literally 24/7. There was no morning about my morning sickness. It was everything, all the time sickness, and it lasted most of the pregnancy, not just in the first 3 months. Like, good luck with that. I thought, oh yeah, it's going to go away after 3 months. No, it was the entire pregnancy. It was horrible. And I turned to this naturopath that we're traveling with, who's also a big time homeopath. And he asks me a few odd questions and says, okay, you got to get this, this homeopathic for you. And if that one doesn't work, get this one too. And we were like a half an hour away from anywhere that would sell them. And so I had to wait till the next day. And it was an agony all night long, was agony all morning. And my husband drives me to the Whole Foods, which was the only place that was, anywhere near us. Because we were kind of out at that point. We weren't directly in Portland anymore. We were sort of out in the middle of nowhere. And he tried to get a coffee, and I nearly threw him out of the car because just the smell of coffee from a mile away was setting me off. And I couldn't believe it, because normally I'm a very, like easy to get along with person, and that was not an easy experience. So I walk into the store, like I've got like thick glasses on and a hat on because the light is, horrible. And I feel like I'm going to fall over at any moment. And I grab the two homeopathics, and I don't even care if someone thinks I'm stealing them. I'm going to pay for them. I twist the cap, I pop them, and by the time I go to pay for them, my symptoms have been brought down by 90%.
Nice.
And
Very
I was
nice.
like, okay, and I was going in, I got to tell you, I was going in totally skeptical because, I believe in naturopathic medicine, but I'm always skeptical. It's kind of like, you got to prove it to me, right? I'm not going to this isn't a placebo, because I didn't really think it would work, because I was thinking I needed to take 8 Advil, and I took 3 little tiny white sweet tasting pills, which are homeopathic medicine, and between those two homeopathic remedies, I basically had to take them every half an hour, every hour, and it just kept bringing my body back into balance. Anytime I started to feel the symptoms, I'd pop it. Sure enough, I'd get it. Either I'd have a hot flash, I'd pop it, the hot flash would go away. I'd start to feel like I was going to throw up, I'd pop a few homeopathics, it would immediately go away. And it was like one of those experiences where am I dreaming this? Can this really work that well? So, because we are brought up in the society where, okay, it has to be proven on a blood test, and then you have to take a pharmaceutical medication for anything to work. And so to see that something, which in my understanding, homeopathic medicine is like energy medicine, because it's really the frequency of something. Is that correct?
That's essentially right. Yeah, and that's why, of course, homeopathy was debunked, quite a few decades ago by modern medicine, by allopathic medicine, as being placebo. Because if you analyze it chemically, you'll find that now. So we homeopathic remedies are primarily diluted in what are called X, C, or M parameters. X stands for a 1 to 10 dilution, C is 1 to 100, M is 1 to 1,000. So in other words, you take one part of the originating substance. Let's use something really simple like allium cepa, which is the common onion, okay? So here's the formula, right? You're cutting onions on your chopping block, and your eyes start burning and stinging, and your nose drips, and you can't stop it, right?
Mm-hmm.
So here's the deal. If you're having a symptom of burning, stinging eyes with a clear discharge dripping from the nose that you can't stop, if you have those symptoms, and if you have those symptoms, you're probably going to think, what? You got a cold, or maybe you're having an allergic reaction, right?
Mm-hmm.
So here's the beautiful thing about homeopathy. It doesn't matter, where it came from. What matters is this symptom complex that matches the symptom complex induced by that same substance used in its normal form. So now we take allium cepa, and we're going to take one part of it and dilute it with 9 parts of water, and then we're going to hit it 10 times. In the early days of homeopathy, homeopathic medicines were made by monks who made homeopathic medicines by hitting them against leather-bound versions of the Bible.
Mm-hmm.
And it's the dilution and the hitting that induces the release of the frequency band that will neutralize the symptom complex. So if you have a cold and you take homeopathic allium cepa, it will, just like your experience, it can stop it virtually within seconds. The eyes stop burning and the nose stops dripping. And then if we analyze this in a chemistry lab, we can find that there's nothing there.
Right.
Right?
But
there's nothing there.
Right. But if you tried to analyze the energy going through a light bulb in a lab, you're like, I'm gonna put this under a microscope. It's just like we're looking at it with the wrong tools. You're looking at
there you go.
You're looking
See,
at
that's
homeopathy
it.
with the
That's
wrong
it.
tool. You're looking for molecules, and that's not. It's energy medicine, not molecular medicine.
It's perfect, right? See, there's no molecules, but to get to the point where there's no molecules, you have to pass, Avogadro's number, 6.0 times 10 to the negative 23rd power. That is the size of a molecule. So anything that we dilute beyond that point no longer has a molecule of the original substance. When I was going to Bastyr, we were involved in a project taking homeopathic remedies of different potencies and doing NMR studies, nuclear magnetic resonance scans of the remedy.
Ooh.
So if you take distilled water and do an NMR on it, it'll show a particular frequency pattern that will be consistent 100% of the time, right?
Mm-hmm.
So now I'm going to take a homeopathic remedy that's diluted past Avogadro's number. That means we're going to go to 30C or higher. And 30C means we've taken one part to 99 parts once, and then one part of that to 99 parts makes it to 2C, and then one part of that to 99 parts makes it a 3C. We're doing this 30 times. And this is still in homeopathy considered a low potency remedy, but it passes the size of a molecule. So what science would mandate to us, what the hypothesis would be, is that the NMR of distilled water and the NMR of allium cepa at a 30C or higher is going to be identical because there's nothing there. It's just distilled water.
Mm-hmm.
So But in fact, what we proved, and this can be proved over and over if people do the same research, is that the frequency pattern of the remedy is radically different than the distilled water. It's radically different. So as you said, you've got to use the right tool to identify what's going on.
Mm-hmm.
And this takes me back briefly to, a very important point about what I call grounding.
Uh-huh.
In Ober's work, earthing, you may be aware he's developed, they now have shoes and these mats that you can put under your computer or plug into the wall and put under your bed. And what these mats are doing is they're taking a part of the frequency band emanating from the surface of the planet and giving us more exposure. The problem is, and this is a really, really important piece in natural medicine that even in my profession is getting somehow kind of washed under the rug a little bit. The principle is this, Ashley: the whole is greater than the sum of the parts.
Mm-hmm.
The whole is greater than the sum of the parts. The first drugs that were ever made were made by taking plants and then identifying an active alkaloid constituent within the plant and then extracting that constituent and concentrating it in a pill or a liquid. That's the drug, right?
Mm-hmm.
So that's the first level of drug creation. What we've done from that point is most drugs now are completely synthetic. They're not derived from any plant at all. They're simply made from scratch in the lab. So, you may be aware that we as physicians and as scientists, we feel very confident that we have identified all of the pieces that make up life, right? We understand all of the biochemistry, the molecules, the particles that make life up, right? Mm-hmm. And we have, in the laboratory, taken all of these pieces into a test tube and even added electricity, given an electrical charge, because we should be able to make life then, shouldn't we? And what's happened is, to date, nobody has ever succeeded in making this slurry of substances come to life. What we've created is soup, but not life.
Mm-hmm.
And that's because the whole is greater than the sum of the parts. Life, there's something in living that transcends what we're made up of. And so in naturopathy, one of the things that's happening is a lot is something we call green allopathy. It's using natural substances to replace drugs. Mm-hmm. Kind of like a one-for-one. And then we're using natural substances where we have isolated the active constituents of the herbs so that it's standardized. So now it looks even more like a drug because we can say that there's exactly so many milligrams of this ingredient, right? Mm-hmm. And what that does is it lets us enter into the credible zone of scientific research and medical the parameters of doing traditional medical research. The problem is that it's stepping outside of our own foundation, where it's like in my office, my favorite medicines, even though I make a lot of IVs and I'm using green allopathy and I'm using things that have synthetic analogs. So don't be confused. I'm happy to use this medicine to help people, but my favorite stuff are my herbs and my essential oils in their whole form. Mm-hmm. So that I'm not trying to take these isolated constituents out. I'm trying to recognize the value of the whole herb. So
right, you're very pragmatic, though. I mean, you have this respect for all tools as long as the tools can give us the best result, right? So if you're helping someone with cancer, it's okay to use an IV because if this is the best tool, it's going to give them life. You're not like on your high horse with some principles around oh, I'm natural medicine, so I don't use an IV. You're not like that at all. You're very pragmatic, and but you want to use the best tool that gives the healthiest possible outcome, and really get using something that is in its whole, right? So it's like I could take a capsule form of some extract from broccoli, for example, but I'd be missing out on 1,000 phytonutrients and chemicals from that broccoli that play all these roles in my body that haven't even been discovered yet if I just take this one isolated, extract from broccoli. So it's if we can eat enough healthy organic, broccoli grown on a biodynamic farm, then we'd be getting so much more nutrients than this very sterilized supplement. And I love supplements, don't get me wrong, but
well, exactly. So here's that's a good example. So the primary constituent in broccoli that we're all very excited about is a substance called sulfonophone, and it's it's a sulfur-based molecule that has very potent anti-cancer characteristics, primarily with cancers that are reproductive in nature, where there's a hormonally induced component.
Mm-hmm.
And so what you need to know is you can't eat or juice enough broccoli to get enough of that to be clinically useful.
Mm-hmm.
So here's the best of both worlds. We use the extract and we use the whole plant as well.
Mm-hmm.
Right? And whatever else. When I can get my patients to the point where all that they're doing is, that they're all their medicine is diet and lifestyle. Nothing else. Diet and lifestyle. Nothing else. I mean, that's the highest state. And in 35 years, how often have I been able to get people to that place, or they're willing to do what it takes to get to that place? Slim to none. But with the addition of, just a few extracts or a few nutrients. I mean, at the beginning, as naturopaths, we often overload our patients with pills. Candidly, we do. We're famous for pushing a lot of pills, natural, mind you, but pills nonetheless. And the key is, finding this balance point and really being more responsive to our patients' needs. I mean, I have, patients that come all the time that say, I've come to you because I know that you will do nature cure. And you'll also tell me if it's not working that we've got to reconsider. But, it's like I'm always willing to let the simplest thing work first, and then we start upping the ante. And the beautiful thing is that we have tools like high dose intravenous vitamin C and ozone and ultraviolet blood, and now, Ashley, we know how to make essential oils and use them intravenously for patients.
That is so fascinating. I want to talk about that in a sec. There's a few things I definitely want to touch on in this interview. And Dr. Morris, I have to have you back on the show. I just have to say this. I know my listeners, I mean, if my listeners are anyone like me, they're on the edge of their seat, just loving learning from you. We could have you here all week. So I'd love to have you back on the show for sure. I want to touch on a few subjects. I want to first say, homeopathy. For those of you who might still be on the fence, I have been using it with my son. He is now 25 months old, so he's just over 2. And in it 100% of the time, homeopathy works with him. When he's crying from teething, and he'll tell us now, he'll go mouth, because his molars are coming in. And he has a great vocabulary for a 2-year-old. He'll say, mouth hurt, mouth. Oh, and he is just bawling. This poor little guy, tears are running down his, drool is coming out because his body is in so much pain. The molars are coming in. And I give him his homeopathic. I say, we call it candy. So just so you know, like my household, crunchy granola hippies here, he's processed food has never passed his lips. We don't feed him sugar. And I know, and he loves vegetables. So I feel really blessed that he's kind of on board, because I know he has his own personality, and he's so on board with us to feed him as much organic whole food as possible. And my heart goes out to all parents, because it's not easy. I'm not saying it is, but I don't feed him junk food. I don't feed him processed food. I really I do my best to make sure that he's fully nutrified, and in a fully nutrified little body. I say, here, do you want some candy? And that's giving him one of his homeopathic remedies. And he actually gained dexterity early on because at like 6 months old, we had him try to pick up a little homeopathic balls with his hands.
Pellets. We call them pellets.
Pellets. Thank you. I knew there was a word. And so he takes it, and calm comes over his face. Now, how would he know as a 3-month-old or 6-month-old, when he had gas pain when he was a newborn? How would he know? It could not possibly be placebo. How would he know that would help him? And so any issues we've had, be it gas pain or fever, or teething, or congestion, or diarrhea or constipation, any of that, we always go to the homeopathic. And then he fell in love with essential oils. He actually gained access to my essential oils, and he brought me the lavender, and he's like, open. And I'm like, okay, he's picked lavender, and I opened it, and he loves smelling it. And then he tried to put it in his hair. I said, you want some in your hair? He says, yes. And he hands it back to me, and I put a drop in his hair. And oftentimes when he, as he goes through teething pain, he'll ask me for lavender in his hair. And so it's just that the kids are really responsive to this, and it couldn't possibly be a placebo, because how would an infant know to have relief from a placebo? So that's my little.
So Ashley, we I agree, and this is as homeopathy has used exactly what you're saying, in modern times, to be at least part of our rationale. And that is, right, if you give it to infants or you give it to animals and it works, how do you explain it? And the answer is because there's something there. Something really happened. It's only adults that can second guess it, that can go, no, I don't buy it. Right? And all of that said, of course, I just, homeopathy is an elegant, beautiful system. There's a lot of remedies, and certain cases can certainly get more complex with simple acute prescribing, often with things that children are having and whatnot. It's pretty easy to hit the right remedies. When we're dealing with more complex cases, it can be much harder to hit the remedy. And so the problem we have with more complex cases in homeopathy is that it's like trying to hit the bullseye, at 100 yards, with a 22 versus, having a shotgun at 5 feet. And so what's happened, Ashley, is there's all these remedies in the health stores now that are these combination remedies. Mm-hmm. Like one of the ones for that you talk about with infants for teething is Highland's teething tablets, right?
There's a bunch in there, and luckily I figured out which one was the one that actually was helping him. But you're right. You look on the back, and there's like up to 10 different homeopathic remedies in there.
So classical homeopaths will say, well, the right remedy was in there, so you hit it by accident. But something happens when you mix remedies that becomes something unique that hasn't even been adequately tested. There's a continuing learning curve. The beauty with homeopathy is this: homeopathy is benign. Like most natural medicine, most of it is benign. It's safe. It's harmless. You don't have to be panicked about side effects and reactions. Now, that said, obviously anyone can react to anything at any level, but our track record of safety and efficacy is stunning, particularly in comparison to our allopathic medical colleagues.
Mm-hmm, absolutely.
Yeah.
Now, you have your website, which is residentsoundtherapy.com. I know we've been sort of talking about this, and also just this you're really been painting the picture of helping people understand why energy can be and is medicine and can be harmful or can heal. Now you have homeopathy, which is this classical example. You have this now modern day dilemma of us holding cell phones and being around laptops and just being around a lot of electromagnetic radiation. I've had a lot of great guests in the past, like Sal Laduca, who is a specialist in EMF poisoning, EMF radiation, and what we need to do to limit the amount of EMFs in our life. And he shared in his episode, in his interview, amazing testimonials of people who had who children had sleeping disorders, had attention deficit disorders, and when he helped the parents to limit the exposure to EMFs, the children were like completely different kids. And he, over and over again, he has like people who have migraines, and he gets them to stop using their laptop in their lap while it's plugged into the wall, for example, and all of a sudden their migraines go away. So these kind of things where if you went to an MD, they would give you drugs for it and to try to suppress symptoms, but the body is speaking
and never make that connection,
right?
Never make the connection that you've just identified. So, the part of the key is education. I mean, naturopathy is all about educating patients and helping people, giving informed information to help people make more informed choices. That's the key. And the truth is, Ashley, this is, and I suspect that this was going to be the case with this first interview. This is going to be a perfect segue into going deeper into the energy work, that I do on another interview, that we've kind of scratched the surface, kind of made an introduction, and I think that's really appropriate, because there needs to be kind of, again, there's, I think I shared with you that the whole arena of energy medicine, other than homeopathy, which is very well respected and utilized amongst my colleagues, that energy medicine as a class, in its other forms, is something that we're generally not particularly exposed to, taught, do, or teach. And the reason is because as naturopaths, what most people don't know until they find us is that, we are very science grounded and often extremely critical of ourselves and each other and anything that doesn't have adequate research. So, one of the things I do, for instance, is chelation therapy. This is using an amino acid analog called EDTA to help reverse vascular disease in lieu of a bypass surgery. And allopathic physicians will say, well, there's no research behind this. And nothing could be further from the truth. I mean, there's a huge body of research, particularly when we talk about nutrients and herbs, just massive amounts of research. And most of it's from the allopathic world. It's actually their research, and then they don't pay attention to it, but we do.
Yes, exactly.
But as I said, I'm hoping that we can, pick this up where we left off, and then start to fill in some other very important pieces and some very important simple things that folks we can share to do. Simple things that are very, very powerful. And it starts with something as simple as putting your cell phone down on the table with an airbud, not an earbud, but an airbud plugged in, right? Or, turning off lights in your children's room at night. I mean, the night lights that we leave on, often that alone can be disruptive for behavior and sleep.
Absolutely. You are such a wealth of knowledge. It is such a pleasure speaking with you. Before we end today, I just want to make sure that the listeners know if they're inspired to work with you, which I know I am, that we need to make sure that they know how to get a hold of you. Now, obviously you have your wonderful clinic and you do a lot of therapy there. So is your focus is mainly on cancer, but can people with other degenerative conditions, do you work with, can you maybe give us a list of conditions you love to help people with?
So here's what's true, Ashley. The name of my clinic is Holistic Family Medicine, spelt with a W, by the way, because I don't apologize for this. I'm old school. Holistic, WHOL, is a wholeness, where HOL, the new use,
There's just a whole.
is a whole. And although it looks nice on print and everyone's kind of decided to own it, I'm sorry. I like my W. I'm going to keep it, right? But so the other title in my clinic, it's family medicine. I think this is so funny. I mean, in my waiting room, I've got, boxes with toys and things. And I've had patients for decades that come to me, they're adults, and they come in and one day they say, do you treat children? And I go, well, Gee, I do actually. I treat children, and then I have, of course, the parents that bring nothing but their children. Right? They bring their children, and after years they say, "Well, will you treat me too?" And I go, "What? Yeah, actually, I treat families, and actually I treat all conditions. I have no limit, no restriction on what I will work with, what I will treat, or how. I'm here to help people, to serve people within their needs and on their terms."
Wonderful, Dr. Morris. Now, can people work with you that aren't local? Can people around the world Skype with you? Do you do that, or do they have to come to you?
Yeah, I treat people from all over the world. I do. And of course, I mean, I'll be candid with you. I much prefer, face to face, particularly hands-on, particularly because the energy work I do is hands-on work. It requires physical contact. But, obviously, logistically, that's not possible all the time. And so I'm always happy and willing to work with people, just by phone or email or Skype or, whatever method we can figure out. Yeah.
Wonderful. This has been absolute pleasure having you on the show. The link to everything that Dr. Lance Morris does is going to be in the show notes of today's podcast. Please go to resonantsoundtherapy.com. And if you're in the Tucson, Arizona, or Arizona in general, you got to go to Holistic Family Medicine with a W, Holistic Family Medicine, right? And see Dr.
Yeah.
Lance.
So if you Google my name or Holistic Family Medicine or RST, the acronym for Resonant Sound Therapy, this is the beautiful thing about the internet and and these Google search things. It's like we can all find each other.
We can all find each other. Yeah, we can all be friends. It's all great. Exactly. And of course, the learntruehealth.com in the show notes of today's podcast is going to include all the links to everything that Dr. Lance Morris does, so you can get a hold of him. God forbid, knock on wood, if I ever fell ill or had cancer, I'm pretty sure you'd be the first person I would be calling.
Right. Well, let's hope we meet for other reasons.
Yes, let's hope. Yes, that sounds like a good idea. Oh, excellent. Well, it's been such a pleasure having you on the show, and I'm really looking forward to you coming back so we can dive deeper into resonant sound therapy and this very science-based way to heal the body on an energetic level.
Excellent. Thanks, Ashley.
Enjoy what you heard today on your episode of the Learn True Health podcast. Did something move you, inspire you? Did you get great information that's going to change your life? Awesome. That's exactly what I'm here to do, is to help you gain your health back. Please turn around and share this. If this is something that's helped you in any way, share this with those you love. Love the Learn True Health podcast and want to support us? Awesome. You can go to takeyoursupplements.com and you can support us that way. You'll get access to amazing supplements that are just really great quality for a great price. And there'll be someone on the other end of the line to help you pick out your supplements that are right for you. That's takeyoursupplements.com, or join our membership. LearnTrueHealth.com/join. That's another great way to support our podcast, support our movement, and you'll be supporting yourself. Gain more information, wonderful videos, wonderful trainings, and you'll also be able to share those with those you love as well. So go to LearnTrueHealth.com/join. Want something fun for free? Go to LearnTrueHealth.com, and right there on the front page, you'll see where you can get our free cookbook. I spent a lot of time making it, and it was so much fun. It's really delicious, healthy recipes. And you can also get our 7-day doctor course. Right there, it's 7 days of naturopathic videos sent right to your inbox, and you can learn from top naturopaths on how to gain health naturally. So that's takeyoursupplements.com for wonderful supplements. LearnTrueHealth.com/join to join our awesome membership, which is only open for a limited time. You can get our free healthy cookbook, and you can also get for free 7 days of wonderful naturopathic videos sent to you. Just go to LearnTrueHealth.com and you'll see it right there on the front page. Thank you so much for being a listener, and thank you for sharing and helping others. Let's spread this information and turn this ripple into a tidal wave.